This is my student support system. Keep watching, keep learning.
Blood vessels are part of circulatory system that transport blood throughout the body. Blood vessels vary in structure, size and functions. There are several types of blood vessels: arteries, arterioles, capillaries, venules and veins. The arteries and arteriole carry oxygenated blood away from the heart. The capillary, which enable the actual exchange of water, nutrients, chemicals and gases between the blood and tissue, and the veins, they carry blood from the capillaries back to the heart. Arteries and arterioles. These are blood vessels that carry oxygenated blood away from the heart. They vary considerably in the size, and their wall consists of three layers of tissue: tunica externa, tunica media and tunica intima or interna. Tunica externa. It is the outermost layer of arteries as well as veins. It consists of collagen fibers and vary in thickness between the vessels. The collagen serve as anchor to the blood vessels to the nearby organs. They attaches with the organs, giving it support and stability. The tunica externa contains numerous nerves and especially in larger vessels. Tiny blood vessels that supply the tissue of vessel wall. The small vessel that supply the blood to the tissue of vessel itself. These are known as vasa vasorum. Tunica media. The tunica media is a muscular and connective tissue layer. It is the middle layer that display the greatest variation among different vessel types. In most vessels, it is relatively thick layer comprised mainly of smooth muscles and substantial amount of elastic fibers. The primary role of the smooth muscle cell is to regulate the diameter of blood vessels. Tunica intima. Tunica intima or interna forms the inner lining of blood vessel and is in direct contact with blood and allow the flow of blood through the lumen. It is the innermost layer and is made up of simple squamous epithelium or also called as endothelium, which is continuous with the endocardial lining of heart. The endothelium is a thin layer of flat cells that line on the inner surface of entire cardiovascular system, heart as well as blood vessels. It is very smooth and allow easy flow of blood. Capillaries. The smallest arteriole, that first is artery then arteriole. The arteriole break up into a number of minute blood vessels. These are known as capillaries. Capillary wall consists of only a single layer of squamous cells with a membrane through which water and other small molecules and gases can pass. Blood cells and large molecules such as plasma proteins do not normally cross through the capillary wall. The capillaries form a vast network of tiny vessels that link the smallest arteriole to the smallest venule. In certain places, including the liver, bone marrow, capillaries are significantly wider and permeable than normal. These capillaries are called sinusoids. Veins and venules. Veins and venules are the blood vessels which return blood at low pressure to the heart. Their wall of veins and venules are thinner than the arteries, but they have same three layers: tunica externa, tunica media, and tunica intima. They are thinner because there is less muscle and elastic tissue in the tunica media. Because the veins carries blood at low pressure than the arteries. Some veins possess valve which prevent backflow of the blood, ensuring that flow of blood should be towards the heart only. They are formed by the fold of tunica intima and strengthened by connective tissue. These valves are semilunar in shape. You can understand this system, blood vessel system, by this picture. That first they are large arteries, they break up into the arterioles. The structure of artery and arterioles are same. They contain three layers of tissue. Then they break up into capillaries. Then capillaries again unite to form venules and then veins.
My student support system. Keep watching, keep learning.